everyone, and welcome to this main stage session on raising healthy children. I want to start by applauding the World Economic Forum. I think this is the first session in the forum's history on children's health on the main stage, and we think this is very, very important. As you can see, we have a very dynamic panel. We want the session to be interactive and focused on practical action. So I'll ask one round of questions, and then we're going to open it up to the floor, take 2 or 3 questions, and then open it to the panel and keep coming back to you. So get ready, prepare your questions, and ask them. I'm Josette Sheeran. I'm the head of the World Food Program. The World Food Program, we see a lot in the developing world of what we'll talk about today. We know that we're reaching 50 million children a year that are facing urgent issues of malnutrition and hunger. And we know in the world today there's more than 200 million children whose minds and bodies are stunted and who lose a chance at a healthy life very early in age, especially under 2, without adequate nutrition. Children's brains and bodies, we now know, can never recover from the loss during that period. I call this and the other information we have the burden of knowledge. Today we know that without specific interventions, children lose a chance at a healthy life, and this is not only an issue of compassion, but also one for finance ministers and presidents and prime ministers. The loss to GDP has been estimated by my program, but by others at 6 to 11% of GDP that a country loses if children are unhealthy and bring that into adulthood. And we know for one economy alone that it equals over $20 billion a year. The issue really is, are there deployable solutions? Is the knowledge we have deployable? And also, the dilemma we have of the undernourishment in parts of the world and the overnourishment, if we will, in other parts of the world, the richer world. And today we're going to cover the whole spectrum. And so we know today in many richer economies, we're seeing diabetes in children. We're seeing the precursors of the non-communicable diseases very early in life. And so we have to deal and today tackle both issues. I think you will hear this panel not being all grim. Tremendous progress has been made, and I think there are solutions at hand, and so I think we'll hear some encouragement along with really the challenge that humanity is facing. We'll first hear from Dr. Margaret Chan. This is the determined, no-nonsense, get-it-done leader of the World Health Organization. Last year, we took stock of the 10th year of the Millennium Development Goals. It's a 15-year time span, but we took stock, and the focus was on the Millennium Goal number 4, on children's and maternal health, and are we reaching the goal of reducing the number of children who die before their 5th birthday by 4 million by the year 2015. But last year, 7.7 million children died. Margaret was instrumental in launching last year a global strategy for women and children's health, where stakeholders pledged over $40 billion to invest in the sector. And I'd like to ask Margaret, what are the 3 things that need to be done, that can be done, and that will move this dial?
Thank you, Josette. Good afternoon to all of you. If you look at, what can be done or scale up very quickly to make an impact in improving the health of children, let me give you 3 suggestions. Number 1, vaccine preventable diseases, especially for children. And we have seen how effective vaccine can be. They are safe, they are cost-effective, and they are the best buy that innovation can bring. Look at what polio and measles have done. The vaccines brought these two diseases almost to their knee. And we are very close to eradicating these diseases. And of course, there are new vaccines, vaccines for pneumonia, vaccines for diarrhea, and these are also two big killers for children. So if we can scale up, the knowledge and the action gap is what is preventing us to make huge progress. So if we can scale it up, that will make a difference. We have never seen, for the first time in 60 years, the under 5 mortality for children, we saw it went down to 8.1 million, the lowest ever in 60 years. So we should gear up with this momentum and not to let down. Now, the second thing we could think of and learn from is bed nets. Insecticide-impregnated bed nets for children in sub-Saharan Africa. I was reminded by scientists, well, don't worry about malaria, there's nothing more you can do, it's not going to get better, it's not going to get worse. I said, I cannot accept a status quo. Melinda, you and Bill gave us the challenge, remember, in one of the meetings, the malaria forum. So the good thing is, decision makers make the decision to flood, the households in Africa with insecticide bed nets. Of course, the importance of, combination, artemisinin combination treatment is important. Indoor residual spraying is important. But the fact of the matter is, when you talk to mothers in Africa, you ask them, what worries you as a mother? Malaria, malaria, and malaria. So that is really also, we are seeing great progress. We are seeing reports of reduction of 50% of cases and reduction of 50% of deaths. I myself, together with Techi Yamada from the Bill and Melinda Gates Foundation, and of course the special envoy of the Secretary General, Mr. Ray Chambers, we visited hospitals in Africa. To our pleasant surprise, we saw children's hospitals where they used to keep children, who are seriously sick with, malaria or in coma. The beds were empty. So that's the kind of things, we are seeing on the ground. The third thing is, let's not forget the importance of food and proper nutrition and balanced nutrition. Josette, what you said is correct. What we are seeing in the world is quite troubling. We see famine and feast coexist, meaning obesity. When we have 43 million preschool children obese, just look at the impact. Think of the impact on the health system, on the family. And that's why, we are working very closely with many actors and, of course, with Josette, your organization, to really promote, the first 1,000 days of life. If you get the nutrition right, you give a child a new lease of life. If you don't get it right, you squander their life because they cannot get the benefit of education. And the family, the society, cost is so high. Now, proper nutrition is extremely important, and let's not forget about the importance of diabetes, its relationship to diabetes. Let me finish by promoting one thing and giving you one concluding, a very powerful intervention. This is promotion. Exclusive breastfeeding for the first 6 months of life save lives. And it is free. And the mothers hold the IP. Nobody can take away the IP.
Well, thank you, Margaret. So just to frame this is a cup from WFP programs. This one happens to be from Rwanda. Today, 1 out of every 7 people, 1 billion people, will wake up and not know how to fill this cup. And 1 billion people are overnourished. It's the first time in history. Last year it crossed 1 billion nearly starving people, 1 billion overnourished people, all leading to the types of diseases and challenges that we're talking about today. Our next speaker, Melinda Gates, Margaret Chan told me she gets very nervous talking to her about health because she knows so much. My staff has found this too because Melinda is often found in the villages of the world talking with the beneficiaries, recipients, and partners to their programs. And my staff tells me, Melinda, they've never seen anyone ask more probing questions, get to the solutions, and untie the knots of the problems better than you. What I would like to ask you is, from all of your travels, why are we losing so many children? And why this is no longer rocket science, is it? I'll ask this. We know what to do. Why can't we deploy these more? And what do you think we can easily scale up to make a difference?
Well, those are great questions. And I think, first of all, it's forums like this. I mean, to think about the World Economic Forum having a panel about childhood health, to me, is an incredible thing. And you have to think about what's happened through even this forum that's allowed us to make progress. So let's go back a little bit in time. Without dating myself too much, if you go back in my lifetime, if you go back to 1960, there were 20 million children dying every single year. 20 million children dying. We got that number down to 12 million by 1990. Pretty good progress. Now we're down, as you said, to 8.1 million children dying every year. And the question that Bill and I keep asking ourselves, and I think many of the panelists here, is how do you accelerate the progress on the 8.1 so it goes even faster? So in the next 10 years, we can stand up here and say, we have cut that number significantly. And I think it really comes down to three things. Number one, we need to invest in women. We know that mothers make an incredible difference in the lives of their newborn babies and in their children. We know that women, if a woman gets an extra $1 or $2 in income, she plows it right back into her family in terms of both health and nutrition and education. So the women are key in this. And there's so many easy things we can do. So number one is women. Number two has to do with really investing in these frontline health workers. This is a health worker that goes out and works in the most remote places in some of the countries that we're talking about. So where do these childhood deaths happen? Well, they happen in African nations. Places like Ethiopia and Nigeria have millions of their own deaths, and 2 remote states in northern India. These places, though, are scaling up frontline health workers. I was in Malawi last year. It's one of the poorest countries in Africa. They are working on the MDG 4 about childhood death by getting out these frontline health workers who take health messages out to women. Ethiopia is doing the same thing. India is doing the same thing. And here's how it makes a difference. We have to take those 8.1 million deaths and really break it down. 40% of the deaths are in the first 28 days of life. And what you tell a woman about the first 28 days is slightly different than what you tell her about once that baby crosses 28 days to 5 years old. So in the first 28 days of life, you say to her exactly what Margaret just said, through that frontline health worker, immediate and exclusive breastfeeding. Even if it's hot outside, your baby's going to get enough nutrition by being breastfed and keep that baby warm. We can reduce that first 28 days of life, we can reduce those deaths by somewhere between 20% and 50%. So that's the first 28 days with the frontline health workers. The frontline health workers also then talk about the vaccination piece, which is the piece that you get from 30 days to 5 years. This miracle-saving, life-saving vaccines, they both deliver them in the villages and they get the women into the health clinics to get their vaccinations for children. So that's the third thing I would say. Invest in women, invest in frontline health workers, which countries are doing, and third, invest in vaccines. Vaccines are a miracle technology, and we, I think, in the developed world, take them for granted. I take my children to the doctor's office to get their vaccines. I don't even think about the diseases that we used to get in the United States or the UK or France or Japan. But these miracle technologies, when Bill and I first got into this work, it was taking 15 to 20 years for a vaccine that we knew would work in Africa because we had it. And it was 15 to 20 years before it would get out in Africa. Now we've gotten that lag down to 1 to 2 years. And through this alliance that was actually announced here at Davos over 10 years ago, the Global Alliance for Vaccines and Immunizations, many large donor countries came into that fund. We were able, through something called the Advanced Market Commitment that they made, we were able to guarantee a certain number of purchases of vaccines. So then we could go to the drug companies and say, not only make the vaccines that work in the developed world, but make these specific strains for the developing world, and we will guarantee you a certain number will be purchased. They were willing to bring down the price, and so for the first time, we now have specific strains that are for Africa. I was just in Kenya this week because they're rolling out a pneumococcus vaccine for pneumonia. Well, guess what the biggest childhood killer is in the world? Pneumonia, 1.6 million deaths a year. So this miracle of vaccines It is happening. And we can bring down these deaths by making sure women do the right things in the first 28 days of life and the right things with vaccinations. But it is the world coming together. It's partners like these on stage working. It's governments saying we're willing to invest. It's the drug manufacturers saying we're willing to take some risk that you all are right and we'll get the strains out there. And it's the world coming together to say this is important.
I told you her expertise was very, very deep on these issues. We're very pleased now to have one of the world's leading CEOs, Muhtar of Coca-Cola, with us. Your company has profound global reach, virtually to every corner of the globe. How can a company like yours with such reach help move these numbers, Muhtar? And do you think Coca-Cola can help make a difference in saving children's lives?
Thank you, Josette. I think, without a doubt, we see a very important role for business in this challenge that we're talking about, and we see a role today and an increasing role 10 years from now. It is the reason why we have forged through partnerships with civil society, with partnerships with governments, and other business partners in dealing with issues like undernutrition, challenges like overnutrition, and education, and all related to child health. And I just want to really reflect on a couple of examples of how business can make an impact, how we are seeing the impact, a positive impact. A few years ago, in the Philippines, we worked with the Nutrition and Science Institute. Numbers came out that said that roughly 1 in 5 children in the Philippines, ages 6 to 12, had deficiency, anemia, due to iron deficiency. We developed, through our innovation and supply chain and know-how, a product, a juice with added zinc, added iron, and vitamin A and C. And we started with the Ministry of Education and the Ministry of Health distributing this beverage. First year, 2008, touched about 8,000 students. This year we'll touch about 70,000 students. Efficacy, last year, 40% reduction of that deficiency. Next year, the 100th anniversary of our business in the Philippines will go over 100,000 touch points. Another, and this told us, this is a great opportunity. Let's do more of this. Hence, we have agreed on a new partnership with the World Food Program, I may add, and also the Howard Buffett Foundation, a multi-million-dollar, multi-year program to take a similar approach in a large Latin American nation. And again, we will be touching many tens of thousands of children related that will have a different design because it's a different deficiency, but again, how business makes a difference. My goal is to take this and not talk about hundreds of thousands, but millions, because we know it can be done. If we know that this product right here helped cut that deficiency in year 2 by 40% in all the children that we could touch in the Philippines, we know we can make an impact. And hence, we will scale this up. There is tremendous interest from great partners and institutions like the Inter-American Development Bank, and I know that we can do much more on this journey of partnership that we've started with the World Food Program, and I'm very excited about that. Then there are a host of other areas where we can lend our expertise. Another example is the agreement that we've just reached with the Bill and Melinda Gates Foundation to help raise awareness for vaccines in 2 major African countries and help also lend our supply chain expertise to ensure that those vaccines get to where they're supposed to reach. again, a clear area. But I just want to finish with the notion that there is so much other areas of intersection with child care, health for children, and say the whole subject of women empowerment. We are a big believer in not just gender parity inside the four walls of the Coca-Cola system, 770,000 employees, but also how much more we can do for women empowerment outside of the walls of our system. And that's why we made the commitment recently of 5 million, empowering 5 million more women by 2020. Doing that through our whole entrepreneurial projects in Africa, Asia, micro-distribution centers, touching and enhancing and creating more retailers through breaking down barriers, and then that helps also indirectly, invariably, having a better health for children when women are empowered. And it's so connected. So we have to, I think about it in the micro sense and also on a more broader scale, and business has a role, and I call it the golden triangle: business, government, civil society, more. So I invite everyone to come and help participate in some of these great projects, work, so that we can all talk about millions of children touched, that we can reduce malnutrition and also improve the health of children. Thank you.
Thank you, Muhtar. Powerful words and powerful action, and I think a new types of global coalitions coming together to really address these challenges. Next, I'd like to turn to Lars Sorensen, who's CEO of Novo Nordisk, one of the world's leading health companies and the leader in diabetes treatments. Lars, we're seeing a global epidemic in diabetes, but we're also seeing prediabetes and diabetes in children at an alarming rate of growth. What is driving this? How can we prevent it? And how can we ensure that we're not creating bigger problems as these children grow up and bring these diseases into their later life?
Thank you, and first of all, thank you for the invitation of being here today. As you mentioned, my own company is working in diabetes, and that usually occurs later in life, or even though we also do see childhood diabetes. But sadly, we are seeing undernutrition and overnutrition at the same time. And so before the meeting, I wrote down 3 observations and then a promotion. We are in business after all, so I thought I'd bring a promotion also, perhaps a slightly different one. The first observation, and the most important one, was, interestingly enough, the notion of empowerment of women. I can't say it any better than Melinda did, but I perhaps add a different angle to it, because I believe that the origin of health starts under the fetal development. And the fact that we have an epidemic of diabetes, type 2 diabetes, in a number of developing countries is due to the fact that the mothers themselves were undernourished when they developed, and their children under the fetal development are undernourished, and hence develop a much, much higher propensity and risk to develop diabetes later on in life. So what we should do, and it is such a wonderful thing, we should simply identify the pregnant women, ensure that they get proper treatment as early as possible in their pregnancy, ensuring that they get proper nutrition and enough of it, and also ensuring that they do not develop gestational diabetes so that they get 2 big babies, which causes a lot of problems in connection with birth, but also that primes the offspring to be more prone to develop diabetes later in life. It's a short period of time in a woman's life where she has control, where we can identify the woman, where we can help her. So that was the first observation. Empower the women. They are the ones that are the glue of the family. Second observation is, it's very gratifying to see that the UN is now holding a summit on chronic disease. We have been trying to raise the alarm of the fact that there's more mortality to chronic disease in developing countries, in fact, now than infectious disease, sadly so. And why is that relevant for the debate here? It's relevant directly for children with obesity, but it's also relevant in an indirect sense that healthy societies are the foundation for economic growth. And economic growth and prosperity is the foundation for healthy families and for the ability of the family members to care for the offspring and for the children. Third observation was this issue of a very particular kind of chronic disease, childhood diabetes. The life expectancy of a child in sub-Saharan Africa is less than 2 years if they at all are diagnosed if they have type 1 diabetes. We are trying in our own company to identify these children, ensure that they get diagnosed, and set up a distribution system, set up capacity building system, whereby we will provide them with the medication, the education, and care for them throughout their life, hopefully until we can convince their governments to take care of the problem. And then to the commercial. The commercial should be one to all the business leaders here that corporations can do a lot. And I encourage you to join the Workforce Wellness Alliance, which has been formed here at Davos at the WEF, where companies, by adopting wellness programs, can have such a tremendous impact generally on health, but also, again, on the families, because we have millions and millions and millions of employees. If they are part of our wellness programs, they will bring that knowledge back to their families. That will create a better opportunity for their children to live healthy lives and for generations to come. So thank you very much.
Thank you very much, Lars. Bono, not only do you make great music, but you've moved the world with your attention to issues from aid for trade, debt relief, peace in Ireland, HIV/AIDS, and an attention on children, health, hunger, poverty. Your One campaign has millions of members now. The Red campaign has raised a lot of money for these causes. You've made these causes cool among millions of people who maybe wouldn't have paid attention. On a scale of 1 to 10, how are we doing in the fight to reverse unnecessary, avoidable deaths in children?
Well, I might have made myself pretty uncool in the process, but there's nothing cold about these ideas, and I'm very passionate about them. You ask the right question, which is, where are we? What's happened? And it's a question hanging in the air over meetings like this in Davos. And there's a cynical public, of which I am one of them sometimes, which always asks, are these just talking shops? What happens when people get out on the street and they protest and ask their government to take this stuff seriously, when they buy red products, whatever it is? What can we achieve? Is there anything really achieved if a prime minister makes such matters a priority in difficult economic times? If Bill and Melinda Gates leave a life of commerce and work in this area, what happens? Well, it turns out a lot happens. And just to go back to 2004, I was here. And we saved, and we're part of that process. 6,000 lives a day have been saved, infant lives a day, since 2004. It is an extraordinary statistic. We should be shouting it from the rooftops. It should be on the signage here at Davos. 6,000, kids are alive today, every day. 6,000 a day. And actually, if you can check out the Living Proof campaign, Bill and Melinda's, that's just very, very good news at a time when there isn't much of it about. So I'm so encouraged. I give it a 6 out of 10, though, because there is some jeopardy. And if we want to get to 8 out of 10, I would say these public-private partnerships. Coca-Cola company, I see them, I've met with them over the years, and they are very serious about these issues, and I think that's important. I think we'd have to see, though, real commitment at government level for things like Gavi. So the replenishment of Gavi, that's going to be a test as to how serious we are to get to 8 out of 10. Replenishment of the Global Fund. We saw some problems last October, not hitting quite the numbers they were expecting. So, to be serious about getting to 8 out of 10, that's what it's going to take. For 10 out of 10, I think you probably need another pill, which is a vaccine of a kind against a disease that is killing more kids than pneumococcal, and rotavirus, and HIV/AIDS, and that is corruption. And if you want a multiplier effect on the great results that are happening with immunization, I think we need to tackle that. And transparency is a very, very important piece of this. And you might even have seen this week criticism for the Global Fund for being transparent. It is kind of remarkable. They published their own figures and included some test cases that had gone wrong. And so I think transparency has to be taken very seriously, and I applaud the Global Fund for their transparency as a multiplier effect on all this good work. And that's, in my view, what will get us to 10 out of 10.
Excellent. Well, we've got a good start here. I can barely see out there, but do we have a mic? And first question here.
Hi, Annie Sparrow. This time last year I was running UNICEF's malaria program in Somalia for the Global Fund. Now I've gone back to being a pediatrician. I totally agree with what you've said, Dr. Chan and Melinda, about the importance of vaccines and bed nets and health workers. I would just want to comment from my experiences, which are mostly in Somalia and are not necessarily representative because Somalia is a special case, but vaccines need to be, more R&D needs to be put into the oral vaccines because of the problems with cold chains. And this has happened in every country I've worked, not only in the long-term development, but every time there's a flood, the cold chain's interrupted. Just 2 days ago, I had one of those random meetings in Davos where you bump into a colleague who's produced an oral rotavirus vaccine that's like a Lister mint, which is more than cool. Second comment on health workers, absolutely we need to invest. One of the problems is that for probably all of us here, for me, health is a vocation. For so many people in Africa, it's a job. And in Somalia, we don't offer them enough to make them good. And there are huge competition with the private sector in so many towns in Somalia. There's, 10, 12 clinics. There's between 300 and 500 private pharmacies that are providing the health care. And trying to drag some of those very well-trained people into the public health sector is really hard work because we don't pay them enough and they can earn more selling cut in the marketplace. And so I really applaud what you said, Mr. Kent, about, and what I encourage, I would just love to see more involvement with the private sector to be able to harness that to help us. Because it's such a huge challenge. Somalia is special, but that happens in so many places, that there's this almost competition with the private sector and they get ignored. And finally, for bed nets, I would just say keep scaling it up. It's not Somalia's biggest problem, but bed nets go a long way towards preventing not only malaria, but all those horrible other diseases of childhood, sandflies, leishmaniasis. And I certainly applaud what you've said about Global Fund Bono. I thought they're the most transparent organization I've ever worked for. Fantastic, brilliant, and hugely appreciated by those people that get a net. They can do so many things with that. It goes on and has a long-term benefit. I would just say keep rolling it up. So thanks for that.
Thank you. We're taking notes up here because we're going to take 2 or 3 questions and then go to the panel. We have one over here.
Thanks very much. Jasmine Whitbread from Save the Children. I just wanted to pick up on the point I think Bono made around...
Could you speak closer to the mic? We can't.
Jasmine Whitbread from Save the Children. I wanted to pick up on the point that Bono made around communication and the fact that, and actually it was echoed by other people earlier on in terms of huge progress has actually been made, and there are real concrete things that are going on now that everybody can be part of to make steps to accelerate that progress. And I just think one of the things that the private sector can do, technology companies, but actually all companies have customers, is around marketing. You have huge reach in terms of the messages that you're able to get out there in promoting your own services and products. And just bear that in mind. It's perhaps not an obvious, maybe not everybody can be a Coca-Cola and, reach those far-flung places, but I think most companies can help in terms of getting these messages across, both telling the good news story, the fact that a child's life is saved every 4 seconds, as well as a child's life being lost, and also about what can be done to address these things, what needs to be done, points like the Gavi replenishment, like governments committing, like simple steps that can be taken. This is not an impossible thing. It is doable, and I honestly believe you, Josette, I'm with you, that this is doable. Within 5 to 10 years' time, we'll have a panel up here talking about the success that has been made in terms of saving children's lives, stopping these preventable deaths. But that will only be possible if we really get that message out and get a groundswell of demand for this change, so that it really does become a shared norm. I think it is a shared norm. No one wants to see a child die, but we're not seeing people act on that shared norm to make it a reality.
Thank you. And is there one more? Shall we? Right here, and then we'll go to the panel. Do we have a mic here? Thanks.
Jim Wallace. Bono mentioned this, but I'd like to see it expanded. All of what you're saying makes sense to all of us, but there's a counter sermon going on in governments around the country about deficits and cutting spending. And the finance industry in Washington, D.C. has 5 lobbyists for every member of Congress. How many lobbyists do the children have that we're talking about today? So we need to do more than just offer facts that make sense and ideas, but really we have to offer a new sermon that we're all contributing to. And my favorite preacher, Bono, you're my favorite preacher already. How do we offer a sermon that can counter the pressure to balance our budgets on the backs of the world's most vulnerable children?
Thank you.
That's the elephant in the room, isn't it? The recession and the attrition of aid budgets that are smart aid budgets, and when stuff is working, it makes it just so aggravating. I think twofold. I think you have to show the results to keep the public involved, but the public does have to keep the feet to the flames of their officials. And we set up the One campaign. I used to joke, I'd say, we want to be the NRA for the world's poor. And people would say, NRA, don't say that. And I'd say, no, they're very well organized, and extremely well organized.
The National Rifle Association.
Oh, sorry, National Rifle Association in America. If you're ever wondering why there's so many people running around with guns in the US, it's because of what Jim's talking about, lobbyists and the like. And yet the poor would not have the same force of representation. So that's why One campaign, we wanted 2.5 million members, and it's in Europe, and we're trying to gather that support. And so you credit somebody like David Cameron when he, in difficult economic times, sticks with his commitment to 0.7% and makes a speech saying, we're going to do serious cuts of the British budget, but we're not doing cuts that cost lives. And that was a real moment. And the British people should be very, very proud of it. I'm sure it's a really difficult position for him to hold. So both. But he can do it in Britain because there's public support, because of comic relief, because of, the British are very educated on this stuff, and they know it works. So we have to do that in all the other countries. And, I had to be critical of President Sarkozy. It's his birthday today. I really like him. But I had to put something in Le Monde just saying, we want your leadership. He was talking about new ideas and needing to think differently. But, he's getting pressure to cut. And what Jim Wallace has brought up is actually really, really important, because it's crazy to get this far and to be here, as you were just saying, from Save the Children in 2015, and to have almost broken through. To lose at this moment would be awful.
Margaret?
I just would like to thank you for bringing this very important point up. As you were talking, who is going to champion for the voiceless, the children? You reminded me of what happened in the 70s, when the world was going through pretty similar to what we are seeing here. Oil crisis, food crisis, and a financial crisis. So at that time, many countries were asked to cut their social services, including education and health. And many countries, 40 years later, are still suffering from that cut in social services. I hope this time around, our political leaders would have the resolve not to make the same mistake again.
I was just going to take a little bit on, I think this discussion is really, really important, because we are all, quite concerned about government budgets. And particularly if you look at the Global Alliance for Vaccines and Immunizations, they need another $3.7 billion over the next 5 years. So we got to make sure this money continues to flow. I mean, this is a really important issue. I want to come back just to the issue here about innovations in vaccinations, and in particular oral vaccines versus injectables. So just to be clear with everybody, some oral vaccines require refrigeration, as do some injectable vaccines. Both do today. And she's absolutely right. The cold chain is very difficult in these poor settings. But it does exist today, and the thing that we're trying to do is to take that system apart a little bit and innovate in it. So we put out some challenges to people where we'll give them grants to see how can you redo the vaccines. What's coming out of that is the regulatory process is so long for getting an existing vaccine reconstituted and back through the regulatory system that in fact you need to work even further upstream. So we've got a company that's working on a very, very small thermos that has its own energy source, that doesn't require electricity, and where the vaccines can be kept in deep cold storage, and the whole container can be taken straight from the main depot all the way out to the remote village. So we've got to go even further up the line and innovate in cold chain. And so this is exactly what the private sector does, is they look at the problem and they say, okay, it's not just innovation and technology of vaccines. What's wrong with this supply chain? Why is it so hard? How do we take it apart and innovate each piece of that? So that work is going on. It's just going to take a while for it to actually come to fruition. But it will.
Now you know why Microsoft is such a giant. It's clear.
Get the processes
That's only the
right.
misses.
Muhtar.
Holy cow.
I just want to reference the point about cuts. Many of the programs that we have been able to put into place have been put into place in the last couple of years, all in the midst of this crisis. And I know many other consumer companies that are represented here with great programs, whether it's the Nestle's or the Pepsi's or all the other General Mills, all the other great companies. They have also continued their focus, their commitment, their energy. And it's not just the money, it's the commitment. Whether we lend our supply chain to distribute nets with Nets for Life in Africa, which we do, we've continued. Whether we do, again, the supply chain for getting the vaccines, awareness, the marketing system for creating more awareness, it doesn't take, it's much more than money. It's the commitment, it's the belief, and it's going out and ensuring that you can have those partnerships in place to get results, because the partnerships are the ones that get the results. And I think it's heartening, it's very great for me to see that a lot of this has continued through this crisis, and I'm very happy to see also that now even companies that are coming into the fore from the East, whether Brazilian companies or Chinese companies, they're also increasing their awareness and commitment to these issues. And that's what's so good about what's happening around the world.
We'd love a red Chinese company, if there's one out there. You sort of own the color, kind of. Any other Brazilian? Very good.
Lars, did you have anything?
No, it was just interesting. There are millions and millions of adults that live with diabetes that needs a cold chain. So, in fact, when we're talking about distribution of vaccines, it's the same problem. We need to keep these products in very good shape, otherwise millions and millions of people die. And we think it can be done. It is a matter of us getting together with Coca-Cola and push their arm a little bit, and I think we can find solutions to get things through the furthest part in the world. We can do so at the moment with some medications. We cannot do it with all. But definitely, it's a matter of commitment, as being said, not so much resources.
Margaret?
I'd like to touch on one important point, and which is the power of innovation. I've been in public health for, yes, longer than you think, more than 30 years. Honestly, I don't see major breakthrough without innovation, and that I can, bring up 2 points. One is the food and beverage industry. I applaud you for your self-motivated to restrict regulation to market unhealthy food to children, and also your commitment to reformulate food in such a way that you get rid of all the things that make us happy but unhealthy. So cut the trans fat, the salt, and reduce the sugar. So the kind of innovation is so important. So we look to you to continue this effort and to make our children healthier. And then on diabetes, as a doctor, I still remember, when a patient comes in with diabetes, you send them to different places for education, you see the dietitian for diet consultation, and then you go to the pharmacy to get your medicine or get your insulin. Can you be also creative in terms of the delivery system, where you can have A to Z, total package, to facilitate the health system? Because, many countries' health systems are going through stress and strain. And they are, better prepared in dealing with episodic disease, like communicable diseases, but less well prepared in dealing with heart disease, diabetes. So it is important. I mean, with the education of people, improving, point of care, self-care, but of course, under the guidance of doctors and qualified people, would be the way to go. Because in order to reduce the high cost to the health service, but also empower people. Because, people are very self-reliant, and they have this, if you empower them, they can take action to take care of themselves. So I'm just throwing these at the two gentlemen in the private sector. What can you do to make us healthier?
Well, I'd like to throw another question in this and get ready for your next round here. But as humans, we're very good at naming names when people do things wrong and when leaders do things wrong. And we're less good at naming names when leaders get it right. And one thing I've seen in the hunger business is a nation never changes unless there's a leader that says no more. Children are not going to die under my watch. Now, they may have to rally the world to help them with a vision, but then you start seeing things change. I want to ask you, each of you, what names, not the top name, but what name comes to mind when I say that first, of leaders today, of nations who are making a difference?
Prime Minister Meles in Ethiopia. I mean, people have criticisms about some things his government does, but I'll tell you, he's an economist, and he's taking his economy apart. And he's saying, I care about these maternal and child deaths. And he said, I'm going to train 15,000 health extension workers in my country. I'm going to open, and he has done, 30,000 remote healthcare clinics. They're about a third the size of this stage. And he is making progress on the maternal and child goals in Ethiopia because of that. That is real commitment. And then the government goes one step further and says, okay, we've got the health care workers trained, we've got the facilities. Why aren't the women coming in? How are we going to keep the health care workers out in these villages? So again, they're taking the problem apart one step at a time. But it's absolute leadership from him and his health minister, Tedros. And they're just saying, this is what we're going to do.
Any other names?
They have to be political figures or
Leaders of nations.
I think that again, it's a controversial figure in some ways, but Paul Kagame is doing an incredible job in Rwanda in terms of organizing his health systems. And having visited there a few times, I've just seen, just by visiting clinics, the difference. And he's sort of looking to the future in terms of technology. They're laying broadband. It's a remarkable country to watch. Now, countries that come out of conflict, like Malaysia Zenawi, he was an amazing economist. He by the way, he became an extraordinary economist while fighting a guerrilla war in Ethiopia. And people couldn't figure out how he was such a great macroeconomist. Turns out he studied in the BBC's Open University, a correspondence student while fighting the war. It's a strange story. But that's true. But Paul Kagame, I think, again, coming out of conflict, we're not pleased with some things. The repression of civil society is not good. Sorry, but on child health, he's great.
And his investment in women. I mean, they've decided in Rwanda that a certain percentage of the women in parliament, a certain percentage of parliamentarians will be women. And he says that's changing the face of this country because the women are so involved in rebuilding that nation. And when you go there and talk to these women parliamentarians, wow, are they dedicated and committed.
You've seen the same thing in both cases. Any other thoughts?
He's just left office, but we've done some wonderful work with President Uribe of Colombia, and I do believe that his successor is going to continue both in the area of education, empowerment for women, and also health, children's health in Colombia, in all parts of Colombia. And then now, again, we're very excited with the new program that we're about to embark on.
Any other praise for leadership here?
Don't force us to do that.
Okay.
Well, come on.
I have 193 countries. The competition is keen. And so, they are all my bosses. We better be careful.
Well, maybe I could
you will understand, don't you?
I could take Margaret's slot and just jump in with another leader who's just left. But President Lula was defeating hunger and malnutrition faster than any nation on earth. And I loved it because it was focused on school feeding and a small cash allotment, but the parents couldn't get the cash allotment without a few conditions. The money wouldn't come out of the machine unless the children had all their vaccinations up to date, unless the children got good grades, unless they had perfect attendance at school except for excused absences. I mean, this is powerful combination
and
of...
fighting HIV, he was incredible.
Yeah, nutrition, and I think Dilma Rousseff is going to keep that up from every indication we have. But I think it's important that we get these pace setters and promote their work. They're not the only ones. There are other good ones that really are making a gain. But, okay, audience. One right back there. Mark Malik Brown, and then one behind Mark.
Hi, Brent Blair from the University of Southern California. In honor of elephants in the room, this is probably the largest conglomeration of...
excuse me, we only have 4 minutes left.
Heads of
So you each have 30 seconds.
So healthy children, can we have healthy children without healthy labor conditions and healthy wages? And Lula was a Labour Party member who really also helped the working conditions there. I wonder if we can talk about healthy children with parents who are struggling with 3 and 4 jobs.
Thank you. Thank you. Mark?
Question, but an observation prompted by that last question of yours, Josette. 3 of the 4 leaders, until you mentioned Lula, are fabulous, fabulous development leaders. But as you all implied, there are questions about their democratic performance, if you like. And I think for those of us, and that includes all of you on the stage, who've all followed the concept that development and democracy are linked, it really forces us to confront the fact that there is a new generation of people who call themselves development presidents, who are doing a fantastic job, but do not, on all occasions, meet our expectations on human rights. What is the answer to that dilemma?
Thank you. And last 30 seconds.
Praveen Nair from New York University. I'm an academic used to talking for a long time, but ask a very quick question. Children grow up to be teenagers and young adults. What about them?
And I think we have 10 seconds each for a final, anyone who feels they'd like to address any of these.
The health of youth is extremely important, and that is one of the areas that we discuss. Be it, teenage pregnancy, be it, adolescent diabetes, and this is a group of people, and we have not really have a good handle on. We talk about children, we talk about mothers, but there are something in between. They are called adolescents, and let's not forget their needs as well.
I would say health investments will prosper in open societies and transparent societies, and that's one of the ways into opening up the democratic issues. And I'd just like to say, because I just mentioned the Global Fund there, who were criticised for transparency, because I might have given the wrong impression. There were test cases, I think was the word I used. There are 4 countries out of 145 grantee countries where they found corrupt practices. They outed the countries and themselves in that. Just want to make a point of that.
Just invite the passion and commitment of everyone to come and join any of the partnerships, and let's create more, and let's just be more effective in this area.
And it's great to see so much interest in the room on this topic. Really terrific.
Yeah. Thank you, all of you. Well, I would like to leave putting a heavy dose of pressure on everyone in the room, because we have more leaders per square inch here than anywhere else on the planet right now. I was raised Catholic, and in the Catholic faith, we were taught very young that there's sins of omission and sins of commission. Sins of omission are when you don't know, sins of commission are when you do. We now know a child's brain keeps developing until they're 2. Without adequate nutrition, those parts of the brain never light up. I don't know if World Vision's here, but they have brain scans that show dark parts of the brain. They can never light up. This is now definitive as of 2 years ago. The cost of intervention is inexpensive compared to the cost to society. We've got a few of these on the global plate that we have the burden of knowledge and no excuses not to get it done. So we join and ask everyone to join this groundswell. Save the Children talked about, Coca-Cola, Bill and Melinda Gates Foundation, Bono, all these. This is a new type of global coalition. Let's get it done and report back here 3 years from now that we've really turned the tide on this.